Hello, I'm Caroline from Three Spirits, and I'm going to take you through my poster here. What my poster essentially shows is the way that we cultivate and share knowledge. We're interested specifically in how we improve dementia care practice. And as an organisation, we have been monitoring the impacts of dementia care educational programmes for a number of years, which we call Tier 4 impacts. And what we're very excited about at the moment is that we are now working in a much more digitally able and aware sector, which gives us new opportunity really to impact practice in ways that weren't available to us before. So what we have been doing is starting at the beginning with an organisational needs analysis with organisations, and we work with multiple organisations through community to hospital to local authority. And what we're doing is we're engaging with them at this stage to see what the local enablers are, what are the strengths specifically in the organisation, and what can we contribute to. We're looking at that point at engaging a number of stakeholders, and obviously we speak to the managers and also people with lived experience. But what we're finding and what we're trying to do much more of is to have access to the people practicing frontline in terms of what they determine their learning needs to be. And you'll see that throughout this, there's a lot more opportunity for people frontline to be much more self-directive in their learning, because we actually waste a lot of money in learning interventions that people that already have the information or it's not relevant to their specific setting. So what the technology does, it enables us to engage much more with frontline practice with the individual learner. What we're doing at the organisational needs analysis is also talking to organisations about what needs to happen alongside our service to ensure that the learning is really bedded down to practice. We're talking to them about, how roles are developed, how relationships are developed, because essentially learning happens in context of others. So looking at how people are working together and looking at the structures and routines around the implementations of specific tools. So we're then going on to plan our programs, and we're delivering them in two parts, whereas before we delivered virtually, it would be in one part. But what we are able to do now on a virtual platform is incorporate a practice intervention between it so that we can introduce this new tool. And what we're trying to do here is to turn action into activity through repeated implementation, because actually the learning is in the practice. What we're doing in the delivery of the virtual classroom is to use everything that we know around motivational type training engagement, around being emotionally high content in terms of making it relevant, making it practice based, linking to organizational goals. We're incorporating all of that in the actual delivery element, but we're giving lots of space in the second part for people to start to think about what were the problems in implementing new ways of working. And then what we've been doing over a number of years also is delivering what we call impact pathways. And what these are is using memory aids, which often come in the form of these infographics, to get people to create conversations in places, to act as job aids in busy environments, and to really get people to challenge and think at a points where they actually need them. And all of this is supported by a learning and management system. And what we are learning is that we can do a lot more in terms of people accessing the learning resources that they need when they need it, because essentially learning happens in practice. So often somebody will have a problem, they'll need to draw on their learning resources, previous experiences to solve that problem. So what we're able to do here is to provide a platform through an app that creates resources just in time at the point of practice where people need them. The platform also enables us to do pre-reading and pre-assessment work so that people can spend the time actually in the facilitated sessions looking really at a practice level. So we can do some sort of basic, what is dementia, what are the symptoms of dementia, whatever the topic is that we're delivering, so that the focus here can be much more targeted. We're also making sure throughout it that there are opportunities to interact with communities outside of their organisation, because in order for learning to really be innovative rather than adaptive, it needs to be much broader than the organisation itself. So what we're creating with this learning management system or way of working is opportunities to collaborate across boundaries. We're also able to gather data here in terms of people's experiences in introducing new practices. And for a number of years, we have been gathering data on the difficulties that people have in implementing new ways of working. Now, all of our work is informed by all of the fantastic research that's done to improve dementia care. But what we're doing here is that there is a learning from the organisation, from the learner, and that is feeding into the development of new resources, which is also informed by our social media communities, which we then share with a wider community. So essentially what we're doing here is we're cultivating and sharing new knowledge using the interface of technology. And what my research is hoping to explore is what are the interventions that need to be in place to improve the impact of learning interventions, and essentially what wider systems do we need to have in place, what economic models do we need to have in place to be able to cultivate this way of sharing knowledge that benefits all. Thank you for listening.